Okay, so welcome. We're at a tutorial for the Public Health Systems and Policy 2 unit, and we have with us two guests. We have Michelle Grattan and we have John Flannery. Just a few words of introduction. Michelle is probably known to most of you because she now features big in the banner every time you go to the University of Canberra homepage. And she is a fellow with the university, working also on the conversation. But her history, as most of us know, is incredibly long in writing political journalism for Australia. So a serious political historian we have here, who is also well connected to current affairs and will be very likely to stay tightly connected to current affairs for a very long time, we hope. But writing more from an academic point of view now than for the papers. So that's an interesting new direction. So welcome, Michelle, and thank you. John Flannery has joined us at Michelle's suggestion, and I'm very pleased to have John here. John Flannery has a job with the Australian Medical Association, so big national organisation of which you've heard, that represents doctors and is quite a powerful voice in political advocacy in Australia around health. The AMA has, I don't know how many people working for it, but always a high profile in journalism. How many actually? It's an interesting question, John.
In the public relations area, there's 3 of us.
Yeah.
The staff in Canberra is about 40.
Yeah.
But most of those people are accounts and others. We've probably got about 15 policy people. There's 3 dedicated public health research officers and policy makers, which would be the area you'd be interested in. So, and Steve Hambleton, our president, obviously is a regular commentator on health and public health issues. Smoking, obesity, and alcohol abuse being the 3 big ones at the moment.
Thanks for that. As well though, John has had other jobs in his life, and he has been a senior media advisor to Kim Beazley, who was at the time the opposition leader in the Australian Parliament. So we actually have that in common. I worked for Kim a little before John started, and John worked with Kim for much longer. But so that means that John has worked on media and media-related analysis for a very long time. You also had a role in between when Rudd first came to his health reform agenda, working with his National Health Reform Commission.
Put together that report for the government, which is the National Health and Hospital Reform Commission. So I had 18 months with them to that, which was another big public health initiative. So yeah,
and we've talked a lot about health reform, including in today's lecture. So that's certainly of interest to us. Okay, so I hope that's getting you thinking about questions that you want to ask. We're going to start the session by asking some questions that we have sort of exchanged initially, so that we have given Michelle a head start on the sorts of things we're interested in, and pleased to see a few others joining us. Great. Okay, so I'm going to dive in. Michelle, are you ready?
Indeed.
Excellent, thank you. First of all, would you tell us please about what you think influences politicians the most in making decisions?
Well, that's a sort of how long's a piece of string question, but I think that they're influenced by their values, their philosophies, which in turn have an effect on which party they join. So I think that we can be too cynical about politicians, that they really do, most of them, go into public life in order to do some good, to pursue public policies, to most ambitiously change the world, or least ambitiously to change a little bit of it. But of course they're influenced in decision making, and governments are influenced in decision making by rather more low rent things like the tactical advantage, appealing for votes, seeking out where the party can get additional support, shoring up some areas of difficulty. They're also, I guess, influenced by, if we think not here of individual politicians but governments, by the sort of advice that they get from the public service, from their own advisors, people who are pushing particular policies, and of course that takes you immediately to public pressures, to interest groups. They're influenced in their decisions increasingly these days by sophisticated market research, by focus groups. For example, I think that the line that the Prime Minister is taking, this is not of course on health, but the line that the Prime Minister is taking at the moment on foreign workers, it has been quite influenced by Labor focus group research. So if you look at the influences, they're many and broad, and you can see them as a sort of hierarchy, if you like, from the general philosophical basis that they come from down to the rather more grubby, how do we get votes this election?
Yeah, it's often said in particularly recent political commentary that those polls and focus groups have had too much of an influence. How do you weigh that up? What's too much of an influence?
I think it's very difficult to say what's too much, but I do feel that in more recent years there has been something of a sort of invisible line crossed where the media, which of course now runs in a 24-hour news cycle, and the politicians who respond to the media and to this increasingly sophisticated research are all driven too much by really how they're reading the community rather than them leading the community but also seeking community feedback and being influenced by that feedback but not driven by it, if I can make that sort of distinction. And I was just thinking in the last few days on the Hawke-Keating government and talking to people about that, because 30 years ago today that government was elected. And of course that government pushed very significant reforms, even though those reforms often were going against the sort of Labor Party thinking at the time or immediately before. And I think if the news cycle had been quite as intense as it is at the moment, and if politicians had been quite as driven by research as they are now, it would have been more difficult to pursue those reforms. Now, I'm not saying that the media wasn't pretty intense and that research wasn't important, but it's now, I think, more so. And of course there were other factors like effective leadership by Hawke and determination by Keating and so on. But nevertheless, to drive reform, you can't always just be looking out to the latest poll.
Yep. John, would you care to add something there, especially having worked right up close and personal to a leader of the opposition?
Yeah, well, I think Michelle's point about the news cycle and the shelf life of a policy is very much changed now than what it was 10, 20, 30 years ago. I think you'll see what's happening. One of the difficulties that the current government has, not just because it's a minority government, is it announces something and it has an inability to maintain it, to sustain the message, because the news cycle brings something else in very quickly and the focus goes off. Like their industry package 2 weeks ago, I think it lasted about 6 hours before something else came along. And also the media frenzy around non-policy politics, personality politics, stuff-ups, gaffes, that takes over. Craig Thompson's stories take over. Arthur Sinodinos is getting it done this week. So it moves so quickly, it's very hard. And that's where Hawke-Keating 30 years ago had the advantage. They could sustain the argument over a longer period of time because there was nothing else distracting from them. Another quick comment about health policy specifically, rather than Michelle's broader stroke, is health policy sells on votes, and the things that influence people's votes in health is usually access to services, either hospital or primary care services. So things like plain packaging, while a huge and world-leading public health initiative, is not the sort of thing that's going to swing a vote too much either way, and it became a bipartisan issue anyway. But you'll find things like emergency waiting lists for elective surgery, getting to see a GP or an allied health provider when you need them. It comes down to money. And not just the amount of money, but how money is spent, I think, is the sort of thing that will sway votes in health.
Another thing that can influence decision making, I think, just thinking about the health policy, is if something breaks out, some scandal breaks out. There's been a dramatic case of, there was a woman who had a baby without any aid the other day, wasn't in the paper, and that will focus attention on that hospital and that problem, which can sometimes have a distorting effect on policy, I think, because things are fixed up with band-aids rather than going to the more fundamental priorities of the system.
A primary example being the Mersey Hospital, Tasmania, 2007.
Can we come back to that when we ask about health reform, because that's such a nice lead into it. I just want to pause there to acknowledge that the Dean of the Health Faculty, Professor Diane Gibson, has joined us. Diane, would you like to come up and say a word while you're here, or would you prefer we bowled on?
No, I think that having arrived later than I had planned, I'll try to minimise my disruption, but I'm very pleased to be able to spend a short period of time with you before my next exciting meeting.
Thanks.
I'm very nice to apologise that I was so much.
It's all right.
It's a big campus sometimes.
It is a big campus. Sometimes you think you can get from A to B in 2 minutes and you can't. But thank you for coming. Okay, let's move on, because we've got lots more exciting questions here. Now, next one is, though, about the daily life of a journalist, a press gallery journalist in particular, and who do you trust? How do you, sift through all of the information and rumours, and where do you generally, when you need to quickly get to a reliable source, who do you turn to?
Well, let me say just a couple of things about the press gallery, because the Federal Press Gallery here is maybe not unique, but quite unusual, I think, in that all the people essentially who cover national politics in Canberra, who live in Canberra, cover national politics, are all collected up on the Senate side on one floor, cheek by jowl, 200 or 300 of us, including all the camera people and so on. And that is quite unusual. In the United States, for example, or in Britain, you wouldn't find that situation. You'd find in the White House that there are just the White House correspondents, not the people who cover health and education and all those sorts of issues. And it's an incredibly busy place where your material is flowing in all day. It used to be flowing in through press boxes, now basically through email. You can never actually keep up with your emails. You end up with, well, when I moved from the Age just recently, I had 20,000 emails. I hadn't not read all those 20,000, I hasten to say, but nevertheless, for some reason, I'd kept all these emails, and the cleaning out process was a nightmare. But hundreds of emails come in every day from ministers, from the opposition, from lobby groups like the AMA, from all sorts of people, and if you're on lists, of course, from state governments too. So there are so many participants and stakeholders that journalists have to take note of. So the information comes from the politicians directly, from their staff, from departments, from outside groups and others with an interest in politics. Also, you are overwhelmed now by 24-hour news. So think of Sky not so much as a television channel, but as a big bulletin board. When a minister wants to talk, instead of going to half a dozen newspapers and 3 or 4 other commercial television stations, he or she will just go on Sky, blah for 10 minutes, and they've said what they want to say. It's an easy way of getting messages out, same for the opposition, same for the interest groups. From the journalist's point of view, all this blaring is going on from morning to night, because Sky is actually a good resource. We have it on all day, and so the people, the participants are talking there, the journalists are talking there, as John has said before, one issue tends to just follow another. So, you know, they'll be talking about foreign workers this morning and something else this afternoon or tonight. But the whole process is like a tsunami of information, and this makes it very difficult for the journalists these days to sift through and get a line through this sort of material. Some years ago, you'd have a press conference, you'd go back to your office, you'd maybe talk to the minister on the phone or in person, and you get the reaction, and that would be more or less it. But now it's just overwhelming and continuous. I think this is one reason, incidentally, that many in the public are quite alienated from politics. There's just too much of everything. Now, coming to the question of who does one trust, in this tsunami, it is very hard to see, you know, the boats that are going to float, if I can continue a bad metaphor. But I guess you trust, well, you should approach most information sceptically, not necessarily cynically, but sceptically and with a questioning mind. Some of it is obviously naturally reliable, like ABS figures or whatever. I mean, if the unemployment rate comes out at 5.4, well, you're not going to say, well, maybe they fiddled that figure. You know that that's solid information. If a minister tells you that the Prime Minister's performance in Cabinet was appalling, he or she may be right, the Prime Minister's performance may have been appalling. On the other hand, that minister might be a dedicated Rudd supporter who wants to spin you a line. So your contacts, who will be politicians, who will be staffers, less these days public servants, because the public service has been closed off, as it were, to the media by modern governments, more or less. But all those contacts will have skin in the game, and therefore you trust their information based on your previous knowledge of their information. If they've been reliable in the past, you'll tend to think that they're reliable in the future, that they're not liars, and that they're good observers. You know, you can, in the days when cabinets were more easy to access, as it were, you could ask a minister about something in the cabinet and he wouldn't be bullshitting you. He would have just missed that item entirely, you know, been asleep or thinking about other things or whatever. So sometimes people can mislead you without any bad motive, but sometimes they can mislead you quite deliberately, and you have to be careful. And even when they are trying their hardest and they are basically objective, everyone brings his or her values to how, and perspective rather, to how they see a situation, and so you have to build in that consideration. If I explain something to you, I may be being quite honest, but I may see something quite differently from the way John would see it. So in judging information, especially in delicate political stories, but also in policy stories, you do have to bring that critical mind and a knowledge of where your sources are coming from, and you should, especially on the delicate political stuff, have as many sources from different perspectives as you can reasonably get, which is easier said than done, I have to say.
To be a bit deliberately provocative then, my experience as a Band 1 at Australian Institute of Health and Welfare, where I was often doing media on areas like homelessness, drugs and alcohol, juvenile justice and Indigenous matters, ageing and aged care, always popular, disability, and homelessness, if I haven't said that already, was that when I did do media, I would make it very clear that the reports we produced were statistical, they were about patterns of service use, the kinds of clients and so forth, and I was happy to talk about that, but I wasn't, as part of a statutory authority focused on research and stats, able to talk about policy. it was very common for me to be partway through an interview and then to have the ground shift and be asked, so what does that mean that our policy is failing? So does that mean, sometimes more subtle, sometimes less subtle, but quite deliberately leading me into an area I always said before the interview started that I did not want to go and could not go. So there was a degree of, there was certainly, I mean, I learned to be quite untrusting, even though I'd set the ground rules first and say this I can do and that I can't do. And on live radio,
not good when you say, no, I'm sorry, I'm not answering that, is it?
Oh,
it's not what you want to say.
I had lots of different ways of saying that. It was generally, as we discussed earlier, Fred, this is, you know, not an area that I'm qualified to speak on, but, or my favourite. The Australian Institute of Health and Welfare is a statutory authority which is responsible for building statistics and information. By the time you got partway into that, the reporter was so bored they'd give up on it. I mean, it's a two-way street.
Yes, I think that is right.
There's a game. The game seems to be more important than the background, in my experience, as someone who had the background but not the policy.
There's probably a range in journalism too, though, I would think, Michelle, without asking you to name names, certainly not. Some journalists are better at making those kind of distinctions about what's a fair question, aren't they?
I'm just trying to assess how and when it changed.
Well, I think it didn't change in a day or a month, it changed gradually. But just thinking back, probably sometime in the Howard government, what do you think, John?
Definitely. I think the pursuit was to get something which was different than what was coming from the minister. And if you were getting that from a public servant or from a junior minister or somebody else, a good story was a different point to the same story from the same side. And if that was coming from a staffer or from a public servant, there's your story. Points of difference make news. Points of agreement don't. So, and I think it did become what we're seeing today. I think it would be at least 10 years ago. I'd say it was very palpable around the early days of the Howard government with the Ministerial Code of Conduct. There was a very visceral, palpable ugliness around Parliament, which was rare then, but which is more common now, where personal and personality politics came into play, and it was a win at all costs from both sides of politics. That culminated back in 97, 98 with Senator Nick, what's his name? Nick tried to commit suicide over the
Sherry.
Nick Sherry over the living away from home entitlements. And since then, I think it's just gradually become what was the odd way of doing things those days is now more common. And Michelle touched on it earlier, it's different ways of getting the message out. Like Sky TV is a great example of keeping the news cycle going. But Michelle's also on Twitter, and so is everybody else on Twitter these days. Twitter is an amazing source of information, and it's also an amazing source of misinformation, which journalists use, which politicians use, which staffers use to confuse and befuddle and win points. Email's been used more often, and I think you can see talkback is more politically motivated these days, and political talkback hosts are now becoming political players rather than political commentators. The atmosphere is frantic, and it's getting much uglier.
I think with the public service, the Howard government, when it came in, was very distrustful of the public service. It thought that it was very Labor-oriented. It's interesting, though, if you look back further, when the Whitlam government came in, it was distrustful of the public service because it thought that after 23 years of coalition government, it was all coalition-oriented, and hence in Whitlam's time, you had this big expansion of ministerial staff, which was partly because they had a big policy agenda, but was also because they really didn't trust the public service. So it's not just sort of linear, it does go in waves, as it were, that a particular government will come in very suspicious. And most governments come in somewhat suspicious, I think, and then realised that you know, the public servants are not all Tories or not all Labor stooges.
So, and have we talked before I came in at all about the role of the journalist as expert? I'm thinking of something like My Hospital's website. You know, now you can go on there and look for yourself if you're bored, and possibly become more bored. And there are a variety of sources of information, including Twitter, but also these immense statistical juggernaut sites. Does that provide an opportunity for the journalists to have the expertise and take us by the hand and lead us down interesting policy paths, or does it prevent the role of the expert journalist?
I think that journalists are actually becoming less expert, because I think that a few years ago, when you had quite an expansion of journalist numbers, especially in Canberra, and an emphasis on policy areas, you had more experts. Now, let's think about health. John will have this at his fingertips, but in the gallery now, you have Sue Dunleavy, who would be an expert in health journalism, and is there anyone else anymore? Mark Metherall has gone.
Mark Metherall's just left.
And you wouldn't say there's anyone in Canberra for Fairfax who's an expert. Is there anyone on the Oz who's an expert?
These days, Sean Parnell has only recently been recruited to health, but he was part-timer on health. He's out of Brisbane. The Australian doesn't have a full-on. Sue was poached back to New Zealand with the general desk from the Australian. But Sue is the last of the Canberra-based professional health reporters.
Mm. And a few years ago, you would have had, for example, someone in The Age, the Sydney Morning Herald, and the Fin Review, all of them knowledgeable about health. And when I say expert, I mean people who could hold their own in a debate among people who knew about health. I mean, not the absolute technicalities, obviously, but the policy issues that you could have here, and they'd hold their own as knowledgeable in that area. Now there has been a complete shrinkage, and health is just one area. You could say the same in the gallery for education. You could say the same for environment, which again a while ago had many more people who were expert and devoted to covering that. Now what you tend to get, even when these rounds are covered, is that somebody moves in and 12 months later they move out. Now,
so couldn't we be really evil then and say what's replacing them are subject matter experts who are inexpert journalists? Quasi-journalists.
What's replacing them in writing?
Well, when I think of the pages of the Higher Ed Supplement or some of the articles we see in opinion pages, they're often written by academics.
Right, I see.
With a journalistic frame or a journalistic bent. These are not trained journalists, but they're actually writing in a way as journalists. So it's almost like the expertise is with the content.
Well, that's no bad thing, but I mean, you can always pick up the journalism, frankly, whereas the picking up the knowledge about the policy is another matter.
Everybody always thinks that their expertise is relatively easily picked up by five.
Well, I think journalism is relatively easily picked up at one level, but I think you do need people. It's very good that you have academics and so on to write on these areas. You also need people who are covering the day-to-day politics with access to the ministers and the opposition people and others. So you need both, and if you don't have that expertise in those reporting on things, then the material going out to the others becomes less good. What do you think?
Well, the opinion pages, there's more space in opinion pages now, and particularly with things like Crikey, the conversation. There's more avenue for so-called expert opinion, but speaking as a lobbyist, the opinion pages are very important for groups like the AMA, the Nursing Federation, Catholic Health, Public Health Association. because you
Vice
can...
Chancellors Association.
Vice Chancellors are all in there. But it's very important because if you're part of the story, like if there's a health reform story, AMA President Steve Hambleton said, Catholic Health Martin Laverty said, Public Health Michael Moore said, you're getting 2 sentences. But if you have a more substantial body of opinion that you want to convey, the opinion pieces, the crikeys, the conversations, the way you can get your full argument across. So lobbyists spend a lot of time trying to get as much free space as they can. In the electronic format, Capitol Hill, The Drum, all these shows which are on News 24 and Sky and other programs where journalists interview journalists about journalists and experts talk to experts about other experts. They're on all the time, and part of a lobby group's brief in the health sector, we're all players in that, is to try and get to be one of those players, because you can get credibility because you're on TV or radio or in the paper, and because it gives you a chance to give your full argument, not just that little snippet in response to someone else's argument.
Now that's a neat way in to a question that I was hoping to ask you both, which is, can you tell us about a recent policy story where the influence of the journalism and the media commentary was really significant, reshaped the issue?
While you're thinking, I'll give you a quick one. It's hospital funding. There was a huge story, and it's still going, which is virtually sort of brought the NHRC report back into... The Health Reform Commission came into being partly to end what they call the blame game in health, between federal and state governments blaming all the issues on each other. And to a degree, we got there because the National Health Agreement, they'd signed up to it and said, yes, we're responsible for this much funding over this period of time. But there was an incident recently where there was a recalibration of the National Health Agreement funding to the states based on ABS population figures. So what this meant that mid-term of the annual agreement, the federal government took money out of some states' hospital budgets. It was 108 million in Victoria, I think it was about 100 in Queensland, and about 70 in New South Wales were the 3 most affected. Other states got more because their populations had changed. So, and it was one of your former colleagues, Julia Madew at The Age, who broke this story on the front page of The Age, that the Victorian government worked the Victorian media perfectly to say that they were withdrawing services from community and allied health and public hospitals because of Julia Gillard. It came out later that David Davis and Ted Baillieu had taken 600 million out of their health budget just prior to the 108. So they cleverly got the story being the Commonwealth to blame. And quite honestly, I was dealing with the Federal Minister's office, and they were quite honestly inept at responding to that challenge. So they had worked, Julia had got a great story, and it went for weeks. And the federal health people were unable to turn the argument around. And so it was even though the quantum of money taken out at the local level was greater than the federal money, the media battle was won by the Victorians.
And money went
and the money was put back in.
Went. Yeah. But yet the federal government put the money back in,
but the state money wasn't.
Which kind of scuppered their whole logic for using the population data as a change basis. Yep, it's interesting. Yeah, good example.
I think, well, let me use an example which is actually not in the health area, but quite a dramatic example. I think the setting up of the Royal Commission into the sexual abuse issues, the fact that the government responded so quickly and dramatically, in that it was a big inquiry it set up, goodness knows where it'll go or when it'll end. I think that was an example of the coverage and the sensitivity of the issue influencing the government to respond, because it may well be in this case that it's bitten off so much that well, there'll be a legacy there that future governments are going to have to deal with. And they may well curse this government for such an open-ended thing. And also, that incident, again, outside the health area, but that incident at the Defence College, which was a shocking incident, but let's face it, a limited incident of the video filming of the people having sex, that set off about 6 inquiries by or commissioned by the government and the Defence Department. It had an enormous, what they'd call in economics, an enormous multiplier effect for a relatively limited incident. So it was the publicity and the drama and the public outrage and the political sensitivity surrounding those issues that caused an enormous reaction by government.
And the third one would be the drugs in sport story recently, which where the Crime Commission had the big press conference with the heads of the ARL, the NRL, and everyone was waiting for the big explosive story, but it's still not there. So again, it was, I think, going off, as Michelle said, with what was going to be a lot of evidence, but the evidence wasn't there. So now we've got sort of all this suspicion around that whole incident. So it's, again, not the best management of an issue, and the media instantly turned cynical on that one.
Yeah. Do any of the students have any points?
Any questions arising from that, or anything to take the health topics further?
With the sexual abuse subject that you just brought up, do you think it's a political push for the Pope to have resigned, being as though they're going to make a big deal out of the child abuse in the Catholic Church issue this year? Like, they seem to have said a lot about that recently. Do you think that's got anything to do with a political agenda? Or
With him resigning?
Yeah. And
I must say, I'm not. This is a story that I'm not across other than the headlines, so I don't really, I don't feel any way qualified to comment on the resignation. But clearly, for an institution like the Church, this has been a massive issue, a worldwide massive issue to try to deal with, and I guess it's. I don't know a lot about it, but I guess it's an interesting sort of case study in an institution trying to cope with such multiple scandals and something that goes to its very core of credibility and authority and so on.
I think it's interesting. The Australian inquiry is more broad. It's against organisations, like we're talking about the Salvation Army and Scouts and other groups, but it has become an inquiry into the Catholic Church. But I don't think there's a direct correlation to the Pope's resignation, because Ireland, I think, is into its 9th year of its inquiry. The United States has got another examination of the Church happening, and I think there's other countries coming into it as well. So it has been going on for some time, and our former AMA CEO, Francis Sullivan, went recently to join the Church's internal inquiry for the Integrity Commission, whatever it is. And as he left, he said, that'll take you to retirement, that job, because this inquiry will go for years and years and years.
Let's turn to the health issues then, and we wanted to talk to you about some of the issues in the tobacco campaign, but we've started on to health reform, so maybe we go there first and come back to tobacco. In the health reform discussion, I wanted to ask you how much you think the Rudd momentum towards ending the blame game was a driver, and what he wanted to do was quite clear at the outset, and you were involved with the commission, so you know what he was being told by the community. But what's ended up happening is really quite a long way down the track, and there's been a lot of washing out of issues. Do you think is a thin promise compared to where Rudd's intentions were?
Definitely. The thing about the Rudd reform agenda, and it was a big factor in Labor's election in 2007, because it was about tangible things in health, access to services and affordability of services were the two big brushstrokes that people could relate to. The thing that was in his favour in 2007 was that, and the AMA and others, Christine Bennett, have called that window 2007 to 2010 as a once-in-a-generation opportunity for health reform. One, because you had genuine unity of purpose from the health sector, the community and governments to reform, and you had all Labor governments around the country, which one would have assumed at the commencement of the process there would have been some sort of unanimity in the process. And also the big ticket items that they wanted to reform were the ones that people have been talking about for since Medicare began, that needed to be maintained and built upon to cope with increasing demand, particularly the ageing population. And if you are all going into public health, into an environment with more chronic and complex disease, diabetes and all this other stuff, then you'll know that the demand for health services is going to be beyond the hospital. A lot of community and home services are going to be needed. In short, the Rudd policy agenda was great. It was sort of pretty well universally embraced by the health sector. It had the potential to do big things while the Labor governments were in place. But ironically, it turned out that sort of people like John Brumby were one of the biggest impediments to getting the Commonwealth Agreement in place. Because initially they wanted to go to 100% funding of public hospitals from the Commonwealth. So you wouldn't have that situation the other week where the state and federal were blaming each other. So the money would have come in federally and the states would have been state managers of their services. The Rudd reforms wanted all primary care services and community care services to be 100% Commonwealth funded, locally run Commonwealth funded. That was the slogan they had. That's all fallen apart. The National Health Agreement, which was signed in 2010 and then topped up in 2011, removed that. And they went from the 100% single funder, came down to a 60% federal funder, and it's now a 40% federal funder with an increment in the next 4 years to bring it up to 50 or 60. So
it's 40% of growth, is it?
40% of growth, yeah. So it's going to be a very interesting time going into the election, because at this stage I don't think the Coalition has a health policy except to abolish Medicare locals and GP super clinics. And there's one other that they were talking about.
They want to get rid of some of the agencies. So
the prevention, the Institute of Public Affairs put out a paper yesterday saying that the prevention agency should be abolished. So the health reform agenda, I think, is going to be piecemeal from now on. The opportunity's gone unless if the Coalition gets in, they will nearly have a full suite of state governments of the same colour. They may try something then, but it's unlikely it would be the same magnitude that Rudd was attempting.
Can I, just come in with a few comments on some aspects of this? It does seem to me, looking back on it, that you have to wonder whether Rudd really thought the blame game could be ended, because when you think about it, a federation where you still have very powerful states and divided responsibility is always going to have a blame game. And I think it was always going to be extremely difficult, unless there was a referendum, to actually have full federal or effective federal control of health and health funding. Getting a deal, even with governments of the same complexion, would always be hard. And remember that Brumby was a Labor Premier of Victoria, so it was Rudd's own side, and by that stage also Colin Barnett had been elected, and Western Australia was kicking up, but even a key premier of Rudd's own side was not going to buy this. And of course a important deal breaker is that Rudd wanted to take back some of the GST money to pay for this, and the states said, no, we won't do that, or at least those key states said that. So it was an example, I think, of Rudd having an ambition, a vision, a dream, which was beyond practical politics when you look back on it. And he wasn't sort of willing to go the step that was necessary, although I think at one stage he did want to run a referendum, didn't he? And Roxon and others said, well, it'd be lost, and allegedly he said, well, it doesn't matter, it'd be a good issue. But that you can see that as a sort of criticism of Rudd as a politician. I think Abbott's position is interesting. Abbott, of course, has been a health minister. He wanted John Howard to take over the hospitals at one stage. He is by nature a centralist. I was recently rereading a bit of Battle Lines on this, and in Battle Lines, which after all, this is the book he wrote just before he became opposition leader, so it's not what he said as an 18-year-old student. In Battle Lines, he proposed that there be a federal referendum which would allow the Commonwealth to legislate in all areas, and of course Commonwealth legislation overrides state legislation when there's a conflict. So that would really give the Commonwealth total power in areas when there were disputes. And he even set out in the book a draft bill to do this. Now, of course, these days he's talking about cooperation with the states and so on. But basically, at heart, Tony Abbott is a centralist and would like, presumably in health, but in other things too, to have a more centralised approach. Now, that doesn't mean that he won't be locked into something else, but that's where he comes from philosophically. Mm-hmm. So in a way there's this commonality between Rudd and Abbott, which both of course would like to deny, but if they had their druthers, they're actually on the same page in hospitals, I think.
Yeah, that's interesting. You mentioned the Mercy Hospital in Tasmania, and of course that was when Tony Abbott was the Minister for Health. And he was the first, I think, and John Howard came in behind him to suggest that it was time that Commonwealth looked at taking over the hospitals.
Well,
so
John Howard resisted the wider takeover. He was rather, although John Howard himself was quite centralist. In fact, a number of Liberals like that. You'd think they'd be federalists, but they're actually not federalists. But the hospitals was certainly a bridge too far for John Howard. He had to tie Tony up for a while and keep him on a very short leash.
But the funding factor happening now, and John Della Bosca was the New South Wales Health Minister at the time this report was put together, and I remember him saying quite openly, come and take the hospitals. He says, because it's going to be within 5 to 10 years that no state government is going to be able to afford to run them. He said that the way the costs of health were going, that most of the state health budget would be on health, and so he was quite happy to say yes, take it over, and also the mendicant states now. Tasmania can't afford to run its health system at all. It's saying please come and take everything over. The ACT and Northern Territory wouldn't oppose federal control. Victoria is steadfastly standing up because the Victorians say that they've got the best health system in the country, in the world. And the Queenslanders are now talking about privatising their services. So all your allied health services in Queensland under the Newman plan are going to be privatised. So that's going to throw another spanner in the works for federal-state relations.
One reason I think why Howard was completely unenthusiastic about Tony's notion of taking over the hospitals was that he could see the Daily Telegraph headline of scandal in hospital and you know, people waiting in the corridors and so on, no government willingly takes on that sort of blame. Can I just tease out one point where, John, you said that the whole thing really has been a complete fizzer. Some people defending what's happened say that at least the reporting and transparency requirements have produced something better. Now, I don't know enough in detail about this area. You do. What do you think about that?
Oh, no, the elements of the reform are good, and this is going to be a different. This will be a political battle, because the health sector likes the bits which have created new agencies. So you've got an agency that's going to set the efficient price for hospital services. You've got the Health Workforce Australia. You've got the Australian National Health Preventive Agency. Now these are all separate agencies sitting outside the health department, which makes Jane Holton very angry and frustrated. But
Jane Holton, incidentally, for people who might know, is the Secretary of the Health Department, the top bureaucrat in the Health Department.
So the people who live and breathe health like these things, because you're going to get more up-to-date data on throughput of hospitals. You're going to get more up-to-date information about elective surgery waiting times. You're going to get performance data from hospitals about how they're meeting the targets for emergency, the targets for elective surgery, the 4-hour rule. All those things because at the moment the AIHW reports will be 12 to 18 months out of date by the time they reach the press gallery to report on them. So now you're going to get stuff that's fresh, like within 6 months, the data. So that the people like that, and also the Health Workforce Australia is looking seriously at planning the workforce into the years ahead to make sure that the ageing population with all its conditions has enough doctors, enough nurses, enough physios that are going to be training, but which again will bring another conflict up with the Commonwealth and State, because now they're fighting about, because there's a record number of medical students and nursing students, they are arguing about the full term of their training, making sure that there's in-term positions once they're getting ready to go into the workforce, and that's expensive.
Does anyone have any questions?
Any questions?
Got to be a question.
What about Medicare locals? I know that at some point both Peter Dutton, the opposition spokesperson on health, and Abbott have indicated that they might be up for the chop because they see them as just an extra layer of bureaucracy. But would the medical profession, would the GPs and the community and the other allied health services that are getting access to things like super clinics and getting a bit of support from Medicare locals, do you reckon defend the idea of Medicare locals, or is it not well enough established to be worth fighting over?
Well, it's at the point of no return now, because the Medicare locals have grown out of what used to be called the divisions of general practice, which was all these little groups locally based where the services and the funding were fed through to the local level. Now, the idea of the Medicare locals came out of the NAAHRC. There's 61, I think, of them around the country. And they're all at different levels of maturity. But what most of them have got in place now is contracts. Contracts for buildings, contracts for services, contracts for IT, contracts for infrastructure. They're all there.
And just to explain them, they bring together
all the health services within the area. So
one-stop shop idea.
Your GPs, all your allied health providers, your disability, your carers, imaging, all that sort of stuff is all sort of, they all talk to each other. That's the objective.
And they're supposed to have a health promotion, preventive health kind
very
of
much a prevention
effort
focus
going on too, yeah.
You'd think they'd be pretty popular. You wonder that the opposition is getting rid of them.
Talking about another blame game, this is where there's competition amongst the professions, like the GPs, through the AMA and the College of GPs are saying that the Medicare locals, their boards should be dominated by GPs. and so where they're not dominated by GPs, they get cranky and say they're not good enough. So that's one issue, and that's the sort of internal blame going between the professions. Dutton has taken that on board, and that was his policy, but only last week he was saying it may be too late to abolish them. We will review and reform them.
I thought that statement would be coming. I hadn't caught up with
No,
it,
no,
but he said it last week.
But it's
That's
not in any
really
policy
interesting.
document yet.
No.
The same with the GP super clinics. They have no more of the GP super clinics. Now the GP super clinics are, on paper, they were again another 2007 big promise from Labor.
And most of them are up and running in some form, though I think they're behind.
There's a few big lemons out there. There's
Yeah.
a few big expensive lemons because they were a bit like the Ros Kelly whiteboard affair. A lot of them are located in areas of political advantage in marginal seats. The AMA has been opposed to a lot of them because they've set up shop just down the road from local general practices and are competing with the established local services. But they've actually had an audit done of them by the ANAO. I think the audit office is looking at them now. But they'll be a political issue because forget about the theory and all the big picture stuff in health. When it comes to the election, all politics is local, and it'll be about super clinics being a waste of money or not a waste of money. It'll be about the hospital working or not working. As Michelle said, no government likes to have people on trolleys or giving birth in the toilets of the hospital or all that sort of stuff. They're the sort of stories that will come out in election campaigns.
Well, let's move from health reform. Let's go back to the tobacco story, because this is another fascinating piece of political history in Australia. The campaign for plain packaging of cigarettes was very apparently led by governments, and by Nicola Roxon, first as Health Minister and then as Attorney General when she shifted portfolios. Was it surprising that there was a huge fight about that, though? Who were the interests in that story?
Well, I don't think it was surprising because obviously the tobacco companies have had enormous amount at stake here, because it wasn't just in Australia. Australia was a leader in this, the leader in this, and they knew that if this got established in Australia, it would inevitably have flow-on effects internationally, and that would affect their position, their sales. In fact, probably a lot more in other countries than Australia. I think it's interesting that Australia, in a number of these smoking initiatives, anti-smoking initiatives, has been to the forefront. For example, on the banning of advertising and so on. That made it, I guess, a bit more likely that the plain packaging would be taken up, but not certain, because it was quite a big move. I think Australian officials had been discussing it for some years, and I must say I did hear that the actual initiative came from the Health Department. In fact, came at a meeting from Holton. I don't know for 100% certain that that's right, but that's certainly what I've heard. I don't know whether you can throw any light on that, John, but it was taken up quickly by government. It was something that Rudd was interested in. He'd promised preventative measures, and once it was rolling, yes, it was fought hugely by Big Tobacco. It was taken to the High Court. They had a front, I think, in the retailers group, but there was general public support for it. The smoking lobby, I guess, I mean, the people who actually smoke were not that happy, but in a sense for them the packaging is a marginal issue, one would have thought. But it was interesting that even the opposition, although some took the civil libertarian view, even they eventually had to come on board, because it was an argument that really you didn't want to be on the wrong side of politically. There was very little mileage on being on the side of the big tobacco companies in terms of votes and politics, I think.
I fully agree. And I think Nicola Roxon took this on, I think, because she had one of her parents or both parents did have disease, smoking-related disease.
Oh, right.
Her father died
Her father died
of
of
lung
lung
cancer related.
So it became a campaign for her. But as you say, it was an issue which all the public health advocates were right behind it. The medical groups were right behind it. Big Tobacco poured money into it. They even created a new organisation of retailers, a new retailers association to be a public relations exercise for them. The civil libertarians, of course, played their part, saying there's no place for government in this, the nanny state argument, which comes into most public health debates in the community about alcohol use, drug use, food, advertising of alcohol. There's always that group who will argue that the government shouldn't be in there. But they took it on, and the Big Tobacco hasn't given up. They're still trying to challenge through Hong Kong about brand and copyright issues. But Australia generally has been a leader in getting smoke-free workplaces, smoke-free cafes, smoke-free bars. All that sort of stuff is working well on their front. It'll be a good legacy.
Apart from that retailer group that was, which was a front for the other companies, I think the retailers were more concerned with sort of transition issues, weren't they, than really the long-term thing.
Small businesses trying to house the cigarettes in a way that it was a cost to them.
Yes, but more a transition cost than a long-term thing.
When we talked about this issue amongst students, a lot of students expressed the view that they didn't think the plain packaging thing in itself was going to make much difference to anybody or discourage young people from taking up cigarettes. Was that, do you think, in the public debate? And do any students want to comment on that?
Yeah, well, do they really think it's going to reduce it that much? Like, seriously? The people have been smoking for probably most of their lives anyway, and young kids, if they're going to be influenced, well, they're going to be influenced, and that's all there is to it. If they're going to want to do it, they'll do it. So how much do they expect it to be reduced by?
Well, maybe it's marginal, and I don't think anyone really knows yet whether it will have any effect. But I think the image of smoking, if you looked back over the history of this issue, and I remember when I was reporting on health things when I was early in Canberra, the advertising issue was big then. And certainly I think those images of, you know, cool people smoke, and what was it, the Marlboro Man, and all those quite glamorous ads, and ads which glamorised smoking, I think they would have had an influence on people. And over the years, of course, all that's gone, and smoking, I don't think smoking these days has a cool image, does it? I don't know, among young people. Does it? Does it not? No. And a generation or two ago, it would have had that image. So while plain packaging is probably at the sort of end of the line and therefore is less likely to have an effect like banning advertising, it's still maybe worth doing. And if it's so marginal, why do the tobacco companies care about it?
I think it's more of a blow to the companies, could you say, than changing people's attitudes towards taking up smoking, because having no brand showing like wouldn't personally influence me, but having a picture of a lung or a child, like those pictures have really, I think, made a difference.
Yeah, that's why I don't understand the concept of plain packaging, when it would put me off more if I did see something with like lung cancer on.
They're still on.
They have big,
well, yeah,
and bigger as part of the plain packaging.
Plain packaging, but
The health photos are.
They take off the scenes of the beach or
I think it's all de-glamorising smoking and getting smoking away from this sort of positive, that it has a positive, contributes to your positive image.
it's a cumulative.
It's a divide between advertising in that situation where you're removing brand names and things imagine that there's a certain number of young people where it was a rebellious thing as opposed to a cool thing. You know, it's you know, the rebellion crowd. You know, that's what it's about. And so I think it's sort of who are we actually, you know, targeting with the plain packaging? Are we targeting the limitation of brand name cigarettes and things, or are we actually targeting let's, you know, discourage smoking? And that, I think there is this sort of line where people are very confused as to what they're targeting with the plain packaging.
But you'll get that across your public health sector. There's always going to be an element of the risk taker, the risky behaviour group who will say, society says this is bad, I'm going to have a go at that. And that's the same with drugs, alcohol, binge drinking, all that sort of stuff will have that element to it. But I think Michelle was right, the plain packaging is not only symbolic, but it's cumulative. The combination, because there are so many packets of cigarettes, you could get 50s, you know, and they had pictures of beaches and young women, young people having fun. That sort of cool image was in there. But now you've got diseased lungs and that fellow who's coughing up blood on his hanky. The combination is all there. But at the same time, it sparked new boutique industries. Like there's a whole lot of people out there now trying to make slip-on packages with attractive images so they can put your package.
We're going to go back to the 1930s cigarette case.
The cigarette cases. There's another story around today in the paper about people trying to market these cigarettes. These, you get the virtual experience of smoking with these metal glass infusers, but none of the medical groups are supporting the introduction of those into the moment. But I just think that, as Michelle said, it's another step. You can't smoke in restaurants and cafes, and people who do smoke are doing so in obviously out of the way places now. So there's not much. It's not really cool being the one who's out in the street and when it's -5 in Canberra.
Well, what happened to that strange policy that Tasmania was India bringing in about banning cigarettes under a certain age? I mean, that seemed like a bit of a flash in the pan sort of thing. Like, was that a media turnover thing where it's a real thing about it?
Yeah, each government will keep trying to limit it. Because again, in Tasmania, the prevention, Tasmania, if you look at their public health figures, they've got pretty well worst outcomes across the board in public health and chronic conditions due to people's misuse of substances. So they have a vested interest.
I wonder why that is. Is that a demographic thing, or is it, we don't know?
It's a demographic thing, I don't know what it is, but we went with the Commission, had all these meetings, and we found out that all their rates of diabetes, smoking-related diseases, alcohol issues are very high.
Shall we move on? Anyone else got a question, smoking-related or related to that discussion?
So in the last 10 years, with social media and all that, what sort of impact has that to, say, copyright smoking in your opinion?
Impact on
smoking, or
against or for? The public health groups are all getting into social media now, and I think you'll find on Twitter your public health messages about the harms far outweighs the messages about let's go out and get pissed off our heads tonight. You might get that through some of the party links. Actually, it's interesting with the promotion of alcohol, and this opens up a whole new area of how some of the alcohol brands have their websites and their Twitter accounts. They do, in a way, encourage group get-togethers around alcohol. Some of the bourbon companies run lines of clothing for children and infants, which will have the Jim Beam logo on them, which is something that public health groups are trying to fight at the moment. So you will find the alcohol companies, the tobacco companies will look at more clever ways to market, sports sponsorship, and all these other activities, or local, a lot of the music events, you know, the Groove and the Move, Stonefield, all those events. The alcohol companies are looking at ways to use social media to get people interested in their products. So that's something that's being watched very closely.
Someone was making the point to me also the other day that, of course, from the government's point of view, it's easier to take on the tobacco companies, which are sort of hate groups for many people, than to take on issues to do with alcohol and junk food and so on, because those companies are tougher targets. Now, of course, it's a more complicated picture because where smoking is an unmitigated evil, alcohol and junk food are bad in excess, and so the issue is much, much more complicated. But it is also true, I think, that the companies are different sorts of targets.
And Jane Walton made just that point. She came and gave a seminar here last year. It was very interesting. Now that you're a University of Canberra person, I can share it with you. But that was one of the points, and she was making the point that with alcohol, because it is in moderation, not dangerous, we'll have a much tougher job in a public health sense at keeping people in, you know, using it in moderation. And the harms are kind of still, you know, there's still a lot of evidence about harms that are yet to come in. But we also have a culture, which is still a culture that is largely supportive of getting together around alcohol. So we've got a long way to go. Yeah, you can't, you know, who's ever going to be the politician that stands up against the backyard barbecue? But we all know the backyard barbecue is about having a beer or a glass of wine in most instances, except for a very few people.
Do you think it would be viable for them to put pictures on the alco pots to stop the younger generation getting into alcohol so much, say of cirrhosis of the liver or something, you know, a really disgusting liver, so that might stop them like they've done on plain packaging.
Like the plain, like the.
I think we're away from that yet.
Yeah,
it was very hard to increase the tax on it.
It has been flagged, that sort of stuff, and there are moves now to. There are moves to have warnings for pregnant women and alcohol, going on to wine. And I think that's actually going to happen, and I think that's happening through self-regulation, not through law at this stage. But no, as Michelle said, it's some way off. And the issue with alcohol is the entrenched Australian lifestyle, but also attempts to tax on volumetric tax and all this sort of stuff can be seen as attacking some segments of the community. Cask wine is much cheaper, but efforts to increase the tax on, which would impact most on cask wine, would sort of hit the poorest in the community who drink more cask wine. And it wouldn't touch the growing hermitage, but it would, you know, there are sort of all these social equity arguments around alcohol taxation.
Yep, that's a good point. Let's move on just briefly to talk about the National Disability Insurance Scheme. This is certainly a hot political issue, and I'm interested in what your views are about the main political sensitivities. Both sides say they're committed to it, but what would it look like? What would it look like with a Labor government? What might it look like with a coalition government? Can we tell? What do we think? It's a kind of hard beast to get a grip on, even though we think we want to do it.
Well, I think that a lot of the detail will have to be worked out well on, and it's still at the very early stages. Both sides, as you say, are committed to it, but there's a lot of room for differences with states. There's a lot of room for delay when budget problems hit. There's a lot of room for cost blowout. So it's a huge reform. It's like the Medicare reform, and it will take a long time, I think. But given the level of commitment, you'd have to say that you'd expect in the end it will be in place, but whether it'll be quite as it's conceived now is another matter.
Agree again. It's huge. Everyone wants to do it, but no one wants to pay for it. And it's going to be very, very expensive. And there's two elements to it. There's the National Disability Insurance Scheme, and I think it's the National Indemnity Insurance Scheme. You've got to separate the birth disability against medical accident, which is of big interest to the AMA. The AMA is lobbying to take the legal suing part out of it, as they have done in New Zealand, where they have an accident. The ACCC, I think, is over there, which is a public insurance system which covers all. At the moment, there's still efforts from the legal profession and some of the medical insurance providers to make sure that the ability to sue stays in there, rather than taking it out of the equation, which is a big cost factor. But I don't know how it'll be played out in the election campaign. I don't think it'll get to that. I think 4, 5, 7 visas and boats and everything will be bigger issues than the NDIS.
Well, I think that the government will use it as saying we have a positive agenda, we're a reforming government, we're bringing you this, and the opposition will just try and neutralise that by saying, well, yeah, we agree.
It's been raised by premiers at COAG that maybe we should be funding it by increasing the Medicare levy, which is a tax. Of course, Labor's got now a real problem with any big new tax because they're under such pressure over what they've done on mining and carbon tax. But do you think that that's a possible way, after this election's out of the way, that looking at health-specific taxing might get another life in Australian politics?
Well, I doubt it because anytime soon, because I think both sides will be locked into promises at the election that they won't do that. And, well, breaking promises on taxes is perhaps not a good way to go, as anyone in the government will tell you. So I think it will be very difficult to do it that way, although there's a logic in so doing.
No, there won't be any more taxes, and you've got to realise that the Medicare levy is not a big tax. The Medicare levy pays for a very small amount of health.
Yes, that's an important
but people
point.
have a view that the Medicare levy covers Medicare. It doesn't.
No. How much of the Medicare does it cover? Do you know that?
I don't know the exact amount.
No,
It's not a half. It's not a quarter. Yeah. It's a small amount in the global health budget.
Yeah, thanks for reminding me of that. I might look that up. In fact, one of the students might take up that little challenge and look up for us what percentage of the total expenditure, just from the Commonwealth, Commonwealth expenditure, the Medicare levy is. It's low. I think you're right. No, you're right. Oh well, that will be interesting to see, but we'll get some sort of an NDIS. I've got a few other questions, and this one is a big challenge because there are so many issues underlying it. But what do you think has been the biggest political barrier to improving Indigenous health? Every government's made commitments, every government's increased some aspect of spending, and still we know that we are a long way from closing the gap, even though there's some bits of progress around the edges. What have been the biggest political imperatives to getting it right?
Well, I think not money. I think that many of these Indigenous problems are actually not financial problems. That's not to say that more money is not needed in certain areas, but I don't think it's a money problem. I think I don't think there is one answer to this. If you wanted to go for big things, I'd say that many in the Indigenous community do not have an independent economic base. And from that flows a whole lot of lifestyle issues, and people are not so forced to take care of themselves and have less incentive to take care of themselves. I think in some cases it's also the problems of and again it comes back to not having your own economic base, but the conditions, the communities in which they live. I do think that while many people, myself included, thought the outstation movement was a great thing in its time, that if you live in very remote communities, the health challenges can be pretty great. But I do think that economics is quite important, individual economics. You know, if you've got a job and you're not on welfare, you've got a way of supporting your family, that a lot of incentives flow from that, because your ambitions for your children are likely to be greater. You can see ways ahead that you can't necessarily if you're in the sort of poverty that being on welfare out in a country town very often would involve. Now, you want more for your children, but you don't see the way to get that so clearly as if you have a job and you can see that your children can get a better job if they get a good education, if they're healthy, etc.
Yeah.
Michelle, I agree with that, those sentiments of yours, and I'm just thinking that they're the sentiments that Noel Pearson has been advocating for a while, the work not welfare, and yet he doesn't have a large support base.
I'm not. I want to qualify it by saying that I'm not saying that suddenly everyone can work and the welfare system is to blame. I'm just looking for big things in this.
But I think work is one of the means to establish an economic base.
But it's hard. It's hard in practice because the jobs may not be there, and it does become a bit of a vicious circle. That if people in the wider community, the non-Indigenous community, can often find it very hard to move from welfare to work. It's not even just a question of a low unemployment rate and jobs being available, it's also the whole jobs ready thing, which involves many challenges. Now, for Indigenous people in either, in towns and so on, those challenges are even greater. And so it becomes a real battle to get that economic base. But I think the economic base would help the health thing.
But I think it has to be culturally appropriate work and culturally appropriate ways of establishing a culturally appropriate economic base.
To provide culturally appropriate health services, which is the other part of it.
Yes, for some people, but for other people it will be, the sort of work that you or I might do. I think you've got to somehow mix the culturally appropriate with the generally appropriate, otherwise you can run the risk of trapping people just in a narrow sort of stereotyped area. But it's an incredibly difficult problem, clearly. What's your experience of?
Well, yeah, it's very complex, and the reality is often the image of Indigenous health need is the remote communities, but the reality is most of the impact and the poor outcomes are in the outer suburban, inner suburban, and country towns. Like I think the north coast of New South Wales, I think, is probably the most highly populated Indigenous populations, up around Kempsey, Taree. Rob Oakeshott was talking about this in his lecture. And it does come down to meaningful work. But the cultural aspects are more out in the Yuendamus and those places. But the mainstream health services and access to them is the issue. One of the things with Indigenous health money is oftentimes it's the cost of getting the service to the community rather than the actual cost of the service itself. If you look at some of the services up in the Northern Territory, where there's planes flying backwards and forwards to the Tiwi Islands, to Catherine, all over the place. It's a very expensive way of delivering because there are no health professionals who stay for the long term in the outer communities. So there is a move now to try and train more Indigenous health workers and Indigenous doctors to go from their communities, get trained and go back, and those numbers are growing.
You wonder also whether the scope here for the sort of fly-in health services, because I know, having just done some work about the Western New South Wales, that for the general community, in some of those remote places, outback places, they had fly-in clinics. So the flying doctor would be there every, say, fortnight with a specialist in whatever, and that paediatrics or whatever, and that gave those people in those communities access to services that if they had to travel to the nearest town would be very difficult to get. But the thing is that those people were in reasonable health to start with, so that's a sort of, it's more a maintenance thing, isn't it? Than if they're in very bad health to start with, well, I guess you need people on the ground all the time.
It's not just the money. It's like a lot of health. Not just the amount of money. It's how the money is spent, getting the actual service to the patient. And again, it comes down to the general state of health, with diabetes levels, eye disease, and abuse of substance. There's so many factors where the outcomes are double that of, or 3 times that of the normal population. But your amount of money spent is the same per unit, but you've got 3 times the bad outcome.
I think that, yeah, when we've looked at the demographics in Indigenous health, it's really pretty stark that the urbanisation of the Indigenous population, just like the urbanisation of all of us, is a big consideration, because now the vast majority of us live on that narrow strip of the eastern seaboard, and more Indigenous people are moving, not just individually but in family and community groups, into the centres where they ought to get better access to services, but still are having huge barriers to getting access to mainstream services that are not, for one reason or another, responding fast enough to the needs.
It's a big example of the so-called social determinants of health in Indigenous health, as well as where you can, if you can fix the sanitation, the housing, the education is an important. This is what Michelle was getting at, sort of people being responsible for their own health, and a lot of that is to do with education. So these things go hand in hand, particularly in the areas which are more remote. And ironically, I think the Northern Territory intervention, which was a very political, divisive area, there was an attempt, at least under that intervention, they sent the army in to fix up the houses, the water, all that sort of stuff as part of the process to make sure that at least the living environment was conducive to better health.
Well, one question, then we're going to wrap this up. And the last question is a nice personal challenge. What are your personal keys to success in political commentary? What does it take to stay in the game and stay good?
I'll take some thinking time, you start.
Well, I'm not in there, but I'd say...
But you're an observer.
As an observer, and I've known Michelle for over 20 years from being in and around politics, and I think you'll notice from the changing way that news is getting out. We've talked about social media, Sky, Twitter, Crikey, all these sort of things, and the demise of the specialist reporter. I think we're going to see the demise of the expert political legend reporter too. We saw Peter Harvey sadly die this week. Michelle, I think, and the university is very lucky to get her, because I think Michelle, as we were talking about Sue Dunleavy being the last of the specialist health reporters in Canberra breed, Michelle is the last of the great journalists of great integrity. I'll give you an example of having worked for Kim Beasley and for Bob McMullen and Simon Crean briefly. Michelle was, and still is, the only journalist who will ring you back to check the quotes before she goes to press. And it could be 10 o'clock at night, you'll get a phone call. Mate, Cobber, she'd say, I've just jotted this down. This is what Kim really said to me, isn't it? Yep, and check. You don't have journalists of integrity and commitment who will have that much dedication and passion to their craft as Michelle has had. So if she won't say it, I'll say it, and a lot of people in Canberra will say it. She's the last of the breed, and we're going to miss her.
I think that I think there's going to be a bit of a backlash against sort of quick and dirty journalism, I must say. I think that you're seeing sort of overseas, and you'll see here, that people are going to demand more of journalists in the future. So I'm not quite, I'm pessimistic in the short term. I'm very pessimistic in the short term, but in the long term I think things might be forced to rebalance themselves. As for the success in political reporting, well, I do think some fairly strong commitment to accuracy is really important. I don't believe you can be actually objective, but I think you can strive to be objective, and you can certainly try to be fair-minded. I think it's very important not to be cynical, questioning, as I mentioned earlier, but not cynical about the process, because if you are, I think we should just get out and be done with it. And I think these days certainly it takes a lot of energy, and if anyone's got the secret to more energy, do ring up later.
And thanks. The other thing is the continuing emergence of rumour and unnamed source to drive news. Crikey lives off tips and rumour, and they're anonymous, and they get a life of their own, and they drive a lot of distraction in the news cycle as well.
Well, there's a whole debate about sourcing, and sometimes one has to use unnamed sources, obviously, in stories about leadership and so on. But I think that the journalist has to ask themselves, is this unnamed source representative of something? So if it's just some crank or drunk or whatever, no. But if it's some key person and you know that person represents a group of people or a trend in thinking or whatever, then I think it's acceptable. But the journalist's whole integrity is bound up with the choice of those unnamed source quotes.
Yep. Well, that's a great answer, and I'd have to agree with you, John. We're very lucky to have Michelle Grattan at the University of Canberra. Would we thank Michelle, please, in the name of